the day, the next 2 hours and 2.5 hours progresses. But I do want to point out and acknowledge that I'll be working with my colleague Fiona Flowers from SCIE, who is going to be helping with facilitation and also helping make sure we all go to the right places later when we do some group work.
We hope.
Natasha, hi there. Natasha, who you all know, has been working in the region for a while to support this work. She's going to be facilitating one of the sessions and helped design this session we're embarking on. Chris Rowland will be also facilitating a session, and I'm going to forget the Tina from Peterborough, and my screen's gone off. Sorry, Tina, your surname.
Hornsby.
Hornsby. Thank you. Didn't get there in time. Sorry. Thank you for that. And you've come in to help with one of the sessions as well. That's fantastic. Okay. Do you want to get the slides up, Fiona, and then I'll just very briefly introduce what we're going to do today and highlight how it's going to work. Thank you. Okay. So what we want to do today is reflect on the learning from the last year, nationally and as a region, from COVID-19. What was that like? What went well? What went less well? But more importantly, how do we build on the things that went well, and how do we build into the future in a more positive way? So we want to look at the national picture, and James Bullion is here today to talk a bit about his experiences as the president of ADASS during what was an incredible year, I imagine. So he's going to impart some of his experiences over the last year, so get that national picture. And then we're going to look at some good practice at the local level, and particularly from Essex and Thurrock. And then we're going to break into some group discussions around these 5 themes: co-production, care markets, partnership working, supporting our workforce, and technology and digitally enabled care. And then we'll try and pull out of those discussions some key themes and some priorities for us to work in the future. So I won't go into this slide in any great detail, but here's the agenda for today's session. Okay, before I hand over to our first speakers, I just wanted to briefly highlight some insights that we've picked up at SCIE during the last year. We've been involved in quite a bit of the national work on COVID, trying to support the sector through a difficult period. And we're also involved in a commission that is chaired by Sir David Pearson, former president of ADASS, and Paul Burstow, the chair of SCIE, which is looking at the future of housing and care models. And that's coming up with some really interesting insights and very timely insights about where housing with care, where extra care, supported living might go in the future. So some of the themes we're picking up will not be, oh, sorry, can you just go back to the previous slide? Some of the themes that we're picking up will not be a surprise. So clearly in our conversations with local authorities, money is a serious issue. It is getting very tight for many local authorities. And how do you make it all stack up over the next year, particularly when discharge to assessed monies come to an end, will be a real concern for many of you. More positively, however, we are picking up that local authorities are getting refreshing and revising their approaches to strengths-based practice. They're really thinking about how they extend that into commissioning, into a whole systems approach to working, or a whole place approach to working. And we're also seeing that managers at the middle management level are perhaps struggling a bit with trying to create the right conditions in their teams for strengths-based practice. And we're trying to support that through a new leadership development program that we're delivering with Birmingham University. I talked about the commission for on the future role of housing with care. We surveyed over 2,000 people, and it was very clear from talking to those people that their views on what constitutes a safe place in later life is changing. There's a growing support for shared living type models, for extra care, for supported living models, and I think we're all going to see a dramatic shift probably over the next 2 years into those new forms of or different forms of housing. Next slide. So just 3 final insights from us. We're also picking up through our work at SCIE that there's a huge amount of pressure on the front door. A lot of latent demand is being unleashed now, as we come out of the worst of the pandemic. But also we're seeing local authorities debate how much of their access into care do they put into communities, into community hubs, into localities, and how much do they keep centrally, and how do they make access really genuinely an open door rather than, you know, a closed door, but it work in an efficient and effective way. So that's a real debate that's happening at the moment in local government. Integrated care systems, the white paper is clearly throwing up some real questions about the role of adult social care within these new place-based arrangements. How do we ensure that adult social care has a real strong voice within those new arrangements and has a strong say in how services are developed? And finally, workforce. I mean, Skills for Care and the LGA and many others, ADASS included, are working very hard to think about how we develop a single strategy, a single national strategy for the workforce. And certainly we know that trauma and fatigue and general low morale are a real inhibitor at the moment, and we need a concerted effort to address that. So that was just a few insights from the work that we've been doing at SCIE that I thought would help stimulate our discussions later on. But I'm going to stop talking now. Natasha, have I forgotten anything crucial? Anything else that I need to mention at this stage before I hand on to Anthony and Valentina?
No, I don't think so. Thanks.
Okay, thank you. I've worked with Anthony and Valentina quite a bit over the last year and just been incredibly inspired by their story and how they're trying to shape better care and support. And I just thought it'd be really helpful to hear from them now. Thank you.
Oh, the slides.
Yeah, they've got them already shown.
Okay. I'm Valentina. This is my son, Anthony. I'm 56 and I worked as a social worker for 20 odd years, including mostly in child protection, but also in education in the last 10 years. It was purely generic. I worked in EDT, emergency duty team, or emergency duty service, so it was pre-birth right through to end of life. So I just learned a huge amount. I thought I knew everything, but you never learn everything. Also, regarding Anthony was born at 28 weeks, very, very unexpectedly. And he was on the special care baby unit, as it was called then, for 9.5 weeks. So that was a pretty difficult time. Then 2 months after Anthony came home, he was diagnosed with cerebral palsy. I don't think I'd ever heard of it. It didn't mean anything to me. It was just very scary. I felt just very vulnerable, very lost, very isolated, especially when the paediatrician said, "There's nothing else I can do for you." Those words I will never forget. I also have a number of interests. That includes running, which I absolutely love. It's good for my mental health. It's good for me physically. I run with the dogs every day. Love it. And I'm interested in current affairs, amongst other things. Now, Anthony, do you want to say a bit about yourself?
Oh, yeah.
Those are the cards. Do you want to look at them?
Hello there. I am Anthony Kay. I'm 25 years old now. And obviously, yeah, given my circumstances, I've received numerous different support services throughout my life, and I continue to do so. But I've obviously, particularly during education specifically, I was supported. I had basically one-to-one special educational needs support, like a teaching assistant to help me through my academic studies and catch up. This was particularly helpful when I had my second lot of surgery, because I had 3 lots in total, where during that long time off, I basically had support outside the classroom from my SCIE support worker at the time, who came out and helped me do additional hours of studying and learning at home while I was recovering. Support and interests, particularly about interests, I'm into computer gaming. I like going out on walks during the nice weather. Meeting friends and things like that, really.
You've got other kinds of support in school, haven't you?
And
With CT.
apart from the educational side, I also got general support with physio and OT and specialist seating and equipment such as powered wheelchairs, and to enable me to move around easier and to keep me functioning as best as possible, really. So, and lastly, the thing that I also had in terms of also on the academic side is extra time to enable me to, for exams and things like that, to help me process things a lot better, because another part of my condition is that I'm slower to process information, so that can have an effect. So that's why all those things were in place, in addition to assistive technology such as voice recognition software, where I could just speak and then words would come out and then put it all onto Word documents, and that's how it helped me a bit in primary school and especially in later life at university.
And with impaired hand functions.
Yeah. So that's a bit about me and my current circumstances.
Well done. Oh, next bit's carer's role. I think overall, I suppose what stands out for me, this won't surprise anyone, I'm sure. It's the main thing is just being about fighting for services, and it's just, you know, across services, you know, like education, health, you know, social care. There's other ones I can't think of. And I think when Anthony was a baby and quite a small child, and you can only see these things over time when you've got something to compare it to, I would say it was not easy, none of it's easy, but comparatively easier. I think services, I feel there was more services around at that point when he was younger, and things were more standardised, uniform, a bit more straightforward is what I'd call it. When we got to, as Anthony's got older, obviously his needs have become much more individual, more complex, you know, because other issues, other needs emerge. I just think it's become a lot harder overall. And services that were available, say 20 years ago, for sake of argument, just aren't there anymore, even for, you know, children, let alone disabled adults. In terms of good experiences, Anthony went somewhere, they go from, I think it's either 8 to 16 or 8 to 18, I can't remember which. And Anthony, you went from being about 12, didn't you?
Yeah, this was particularly in the social care side of things, where I went to respite services such as Orchard View, and then day services during the day, where it was like day centres, play schemes. Was it
active and that? It was called active, wasn't it?
There was YPAT as well, which was also very common now, particularly where it gave young disabled people like myself a place to go and mix and do activities and things like that. And in the summer, they did a week in the summer as well. And it was just to give parents a break as well, and that kind of peace of mind. But obviously that was in children's, and with adult services is a completely different story. There isn't those facilities in adults that there were in children, I've found. But
the transition was difficult.
Transition was difficult, but the good experiences I had was growing up as a child, but obviously as I got older it became more difficult, really, I'd say.
Yes. So. And I think, I don't know what Anthony thinks, but I think another good example, because I don't want it to be all negative, because it isn't all negative. When Anthony started university, he went to the local one, Huddersfield, and we had this absolutely brilliant senior community care officer. I mean, you'll depending on authority, you give people different names, but as everybody knows, it basically means an unqualified social worker. She was absolutely, obviously I'm not going to mention names, but she was absolutely brilliant. And Anthony was able to live in a flat and have 2 carers on site. It was quite it was a complex thing to pull together, because it involved, you know, like the local authority, the third sector, charities. I mean, it was interesting, but it was hard work.
Yeah.
Through a lot of effort, we got this care package, and it was just excellent, comprehensive, and it just meant that Anthony could just really just be like any other student, you know what I mean? And we had other issues which were nothing to do with services, to do with the people who ran the flats. There were real major access problems, so we had to get Anthony's OT to do a report and all the rest of it. That went on for months and months. That was incredibly stressful. It took a long time. Eventually we got those issues sorted out. It met your hair curl if I told you what they were. It was ridiculous. But anyway, we got that sorted over time, didn't we?
Yeah.
In terms of things started to go awry, I think it was your second year, wasn't it?
Second year towards the.
Do you want to talk about that?
Final year, where the local authority basically turned around and said, obviously, because it was expensive for them, obviously, but they had the funding in place and they were able to fund it. But then basically the gist of it was the local authority turned around and said that we're not funding this anymore because we're not able to go somewhere. I don't know the exact reason, but
you were told that you were asked, weren't you, one meeting with a new community care officer, and
yeah, because I didn't, for starters, I didn't even know that I even had a new community care officer. I wasn't even told. They just turned up one day, so I wasn't even informed that things changed hands or to somebody else. We're never told that. It just happens.
But do you remember that meeting down in your flat?
Yeah.
And he was asked, what were the question they asked you now? That woman asked you that, or not your normal OT. She was really good.
Another OT that they basically just sent out. The gist of it was she was quite patronising, and she came across like, oh, it's quite
unusual
that I'm living in student halls and university as a student, and I thought that's a bit patronising to say, really. Very patronising. You
just wanted normality, didn't
you?
And you needed support to be part of that student community and have that same experience. You had to have that support in place, which they agreed. Then he wanted to move it, to take it away. And then it worked shortly after that, I don't know how long after, where they said we're pulling it. And there were other forms of support, we're pulling it, we're not paying for it. And I'm not kidding, I spent a whole day trying to find a solicitor who would take it on. Because of, I think it's government legislation now, solicitors, they get funding or something. It's a bit complex, I don't understand it all, to represent people with certain
legal aid,
bits of the law, right? So it took me till that 9:30 till 4:30, and I found somebody who would take it on. One, Chadwick and Lawrence in Huddersfield were going to take it on, and I found Simpson and Miller, who were based, we went to their Manchester offices. They finally took it on. You got like legal aid, wasn't it?
Yeah.
And the upshot was that they wrote to Kirklees saying we'll take it to judicial review. If you don't reinstate what you'd already agreed, then we will go to court with it, judicial review. Kirklees backed down, which was just a massive relief, because it would have meant Anthony would have had to come and live back home.
Yeah, and it would have massively impacted my studies, really, even if probably wouldn't have been able to continue.
I don't think it would have. So anyway, so we won that battle, but it was just another unnecessary, incredibly stressful battle, and too many professionals that just didn't get it. You know, I can't put it any other way, really. Another bad experience was an SCN review that Anthony had at a school. Do you remember at SCIE? We spent 45 minutes wrangling to get this charity involved. What were they called?
Ability Net.
Well done. I never remember the name. Anthony did. Ability Net. Because of your impaired hand function.
Yeah.
We wanted them at the meeting because they had expertise that nobody else had it. His OT said, no, I don't have the expertise on this area. Do you know what I mean? they won't let this person be involved, and after a lot of wrangling, they said, right, she can speak for 10 minutes, that's it. She can't be in the review proper, and you can't ask her any questions.
Yeah.
I mean, I worked top a tree. So we just had to go with that. So there'd be no review at all. I don't know about Anthony, the impression that me and his dad got was that the school were terrified of committing to extra resources. That was their focus, not what was best for Anthony.
Yeah.
So that was a pretty difficult experience, really. Next bit, impact of COVID. Do you want to talk a bit about that? If not, I'll do it.
In terms of the overall impact of COVID, how it's affected me and probably other service users in my situation was obviously because of the lockdown, we all stay at home, and then it was the isolation impact. It was obviously current services like care services had to stop, and enable just isolation started kicked in somewhat. I wasn't able to do a lot of things. I mean, I know everybody else is in that situation, but me as an individual, speaking from that perspective, it was very difficult, I found.
And driving tests.
Yeah, and driving tests and things like that, all that had to be postponed. So that was
affected your independence.
Yeah, that affected my independence in a big way, really. And just the fact that I was clinically extremely vulnerable. Because if I ever did get COVID, it would be quite serious. And actually, my sister did get COVID, but luckily I didn't get it.
That's it. You were awful, you know. Because Anthony's asthma, that's why he's feeling extremely vulnerable, and our daughter got it. Oh God, and it was just a nightmare. You had to keep, try and keep her away from everybody. It was a nightmare. Anyway, luckily you didn't get it.
Yeah.
So glad we've been double jabbed. Let's put it that way.
Yeah.
Yeah. What else have we got? Do you want to mention a bit about jobs? You've been really trying to.
Obviously, everybody else's situation has been quite similar. The job market dried up, so it was more difficult for me to find work and get into employment and things like that. So all round, COVID did make things pretty difficult, really. But the good thing is at least things are starting to improve now, which is good.
But I don't know about you, but I think some that probably want to do COVID. You put your CV on Indeed.
Yeah.
And a couple of people contacted you, and basically somebody knew you were disabled. They didn't want to know, did they?
Yeah, there was that issue as well. Yeah.
And you had that interview, and Anthony were in waiting room, and what happened? They never called you.
For about 10-15 minutes, something like that.
And I put a formal complaint in, and they just ignored it. And I put all the timeline, everything that had gone on, wanted a response, explanation, heard nothing. And then life takes over, and you're just too tired you can't be bothered pursuing it. But finally, where are we now? Future wish list. I mean, one thing that came, I don't know about Anthony thinks, but I've been really impressed with this co-production stuff. It started, he's moved down south now. I thought he was brilliant. This social work manager, and he started it all about, Simon, about 2 years ago. And it was like, I'm thinking, what on earth is, it sounds good, but it's just another talking shop. It won't lead to more. It's the latest buzzword. I was a bit thinking like that about it, but actually, having gone through the process, I just think it's brilliant. It's just a brilliant idea and something that we need to develop. And it really is about power sharing.
It is.
I think professionals really, I don't know what Anthony thinks, but really do want to address that power imbalance. So the share power with service users, working together, listening to each other, and not just these are our services, it's that or nothing sort of thing. And I think integration of services, I know we've been talking about it for years, decades, health and social care. I think that would make things a lot easier. certainly what me and Anthony experienced going through Anthony's transition to children and adults, that was incredibly difficult.
I can say from my own perspective, the problem I had with transition specifically is in terms of, it was never about what I wanted as the individual. It was about what was the cheapest option for them. And the other thing was, there was nothing in the local authority. The local authority had nothing. So it was all outsourced. And I was just basically, because I needed respite services for a bit, but I would just basically put somewhere where I didn't want to be.
Northumberland.
I did enjoy it at first, but then it kind of occurred to me that I don't really want this. Because I think they just seem to categorise you, oh, if you've got a disability, then you can just be bunged anywhere with other disabled people.
And some of them
regardless of how old, and
quite elderly, and
there's an age imbalance, because a lot of them, when you're an adult, they can be a lot older. And saying that for somebody who was 20, even in their late teens, maybe even 20 odd years old, it wasn't the most ideal of places, really.
Because you don't want to play, there's no wrong with dominoes, but you don't want to play dominoes, do you?
Because I've got capacity. I may be physically disabled, but I've got capacity like every other person has. So it's about the individual, really. We need to kind of focus on the individual rather than the tick boxing about what the cheapest option is. It's about focusing on the individual's needs and what they want and how we can provide what they need for them and make them happy. That's what I want to see from moving forward, really. Now going back to what currently, what was in place before all of this.
Thank you. I'm just aware, that was really brilliant. I'm just aware of the time. I just really wanted to hear as much as we possibly could there, but that was really great. Thank you very much. There's a comment below saying that Donamos isn't that boring. That's a debate to have another time, I think. So thank you very much for your time. I'm really hoping that you stay involved and get into the workshops later today as well. And I mean, just is there any quick questions for Anthony and Valentina? Just any quick questions? I'm not doing a good sharing job so far. We're letting the time run a bit too much here, but any quick questions? No. Okay. Well, look, thank you very much. That was really inspiring and very informative, and really sets the scene for James, who's going to now talk to us a bit about his experiences nationally during the last year.
Thank you very much. Thanks very much, Ewan. And thank you very much for Anthony and Valentina, really, for that kind of grounding introduction for all of us. I thought it was really interesting, actually, that point about standardized services when you're younger getting more difficult as you personalize it. And also, you know, to be frank, Anthony, growing up from 15 to 25 over that 10 years of austerity period, actually. Not every young person will have grown up in austerity, but you have, and you know, the importance of advocacy. So I thought that was terrific stuff, and I'm really pleased it ended on that optimistic note of co-production being good. And I won't either enter the debate about Dominoes versus Zelda or Fortnite, but I must admit I don't know how to. So I won't enter that debate. So I'm going to attempt to share my screen, if that's okay, Ewan, and hopefully that's working. Good. Is that? Hopefully I am able to do this. I don't do this very often, so hopefully you can see that. So I just wanted to give a national perspective from an Eastern Region point of view, and it's from the point of view of ADASS, and you all know who ADASS is. We're not the Directors' Trade Union. We are about social policy and furthering the interests of social care. And I wanted to start with the obvious point, really, that in the last year, just the sheer amount of work that social care colleagues did alongside key workers and health colleagues and everyone else. You know, we had a national group, we had pandemic guidance to produce, and we had a COVID task force and a winter plan. And all of the bullet points on this slide, we worked on all these areas, which was a massive amount of work, but it didn't stop us in the past year thinking about the future as well and trying to shape. And there are some lessons, I think, of the past year that will get hopefully carried on into the future. And I hope you would agree that the value of social services and social care has been shown as part of the past year's work, that the importance of social work, although as Anthony and Valentina are describing, there's still a long way to go about balancing strengths-based social work with that fear of review and, what does it mean to work with a person's strengths? It's clearly not resolved that. But the social work as a sort of ethical and values-based career, I think, was really highlighted in the last year, but also the kind of wider role of the council in adult social care. So bringing not just social work and formal care services, but that wider protective environment of local authorities when you look at some of the issues that they dealt with around risk and homelessness and so on. But of course, the other massive reflection is about inequalities, and who this pandemic hit were people who are unequal in our society, including the Black community and including disabled people, particularly learning disabled people, who there is an untold story of injustice there that does need to get brought out in the inquiry. But massive challenges in the last year as well around recruitment and retention and unstable care markets. And we already had 60% of directors reporting services closing. And this was at the time, of course, when one-off money was being ploughed into social services, adult social services. I still think that when that one-off funding ends, we'll have a challenge about services closing and ceasing or changing, as Ewan was saying right at the beginning. And of course, we've had significant increases in needs of domestic abuse and safeguarding in particular, and carer breakdown in particular. And then if you think about the last year from a director's point of view, a very parochial point of view for a moment, of course, we've made savings over the past 10 years, over Anthony's sort of growing up period, of that 7.7 billion. We also had savings to make last year, which of course most directors weren't able to do. And those will get carried forward into the year we're in, covered by one-off money last year. This year, how can we use the lessons of the last year, not to make services worse, but to try and make them better? And there's relatively low confidence at the moment. But also last year was a lot of visioning about what the future might look like. And I put this up from Social Care Future, which is a core vision of living at home with people you love, doing the things you want to do, or as Anthony puts it, walking, gaming, and having friends, which I think it's about having a good life, isn't it? And ADASS published a series of statements around having this conversation about social care, having with the public, having integration, and reviewing how care markets operate so that they are sustainable, and that we try and solve some of the problems associated with choice and with working, trying to address inequalities, housing at the core of it, with a workforce strategy and technology, ordinary technology that we all use, folded into reform. But you can't do any of that without proper funding. And so the key messages that ADASS have taken around the lessons of the past and what needs to go into the future, we've said that the core of the learning of the last year has probably been around reflecting on the very personalised nature of how care services should operate. So what is it that enables a person to live a good life? And part of the flexibility that councils have been able to show in the past year about that, what's happening within families, I think that's what we need to preserve going forwards. So that's the starting point. And then the second is social care in its broadest sense. So not just, as it were, traditional care services, but having a relationship, getting a job, progressing, and thinking about those people who are on the margins, prisoners, people at risk of offending, people who are at risk of exploitation, and so on. So a very broad definition. It's not just about funding, in other words, but we do need funding reform. The other thing about the past year, I think, has been that social care as part of the economy has probably been clocked. That this is the value. It's a bit bigger than the trade deal with Australia, actually, and it's a bit bigger than tourism, and it's bigger than agriculture and fisheries. So all the things that have been in the national economic agenda, social care is a big part of that, and it's 1.6 million jobs. But of course, we've got this problem of vacancies and turnover. In the past year, those things were directly intervened with. We had a very interventionist year because of COVID. So what's to stop us from deciding to be on the workforce quite interventionist going forwards, and not just allowing the market issues to dominate as we allow them to, for example, in retail? And then in terms of housing, of course, it's an obvious social work point to make that every decision about care is a decision about housing. But in the past year, we have eradicated homelessness and rough sleeping in some areas. We have radically accelerated housing as alternatives to residential care. We have residential care services, pattern of services changing with living care in favour of residential care. So it does show what we can do on housing if we wish to, but we are stuck with this perennial problem of how do we shift from crisis to prevention. And I suppose the other lesson nationally of the past year is we really saw social care through the lens of the NHS. That's a good thing because it got attention, but it was problematic both in terms of the discharges from hospital and in terms of a real focus on care homes rather than the broader focus on social care. And ICSs going forward ought to be about integration and prevention. But to do that, we'd have to significantly transfer resources into the community, not just social care and social work, but in community health as well. And then the other key lesson from ADASS in the past year has been about carers. So we made an additional 500,000 carers at least in the last year, and possibly higher than that, I think, when we come to look at the statistics as a result of people caring within families. I mean, Valentina and sort of Anthony's description there of being together, as it were, it enhances the caring role. But in the past year, I don't think we gave a lot more assistance to carers. Councils were there intervening, phoning, and trying to put protection around those situations. But one of the key lessons surely has got to be that going forwards in reform, we need a stronger package of support for carers. And ADASS called for that over the winter, 20 quid a week for carers over the winter period for 20 weeks. To get them through the winter, and I'm afraid we did not get that from government, and I think it's still a lobby point. And then what I wanted to end on was just the notion of we expect reform. We expect it quite quickly. I would be optimistic that the DHSC, who've been having a series of informal roundtables, will come forward with reform proposals. But actually, reform is largely underway now, to some degree. So we have the integrated care systems, the health and care bill will be published probably next month. We've got the introduction of assurance and inspection and refreshing the data and capacity data tracking going on. We've got a review of building the right support. So in the jargon, the learning disability, transforming care agenda. We've got changes to liberty arrangements, which mean, liberty protection is strengthened, but is more of a task for us to do. We've also got the Mental Health Act changes coming, and we've got cost of care conversations going on in councils and guidance coming out shortly on that. We've had a winter plan in the last year. We'll have one this year for sure. I'm sure of that. Let's hope it's funded this time. And then we got given a workforce grant in January. It's been reviewed. I don't know what the outcome will be, but I suspect that workforce will become a fairly strong area of work in the coming year. And then to go back to that vision stuff from Social Care Future, I think every organisation, SCIE included, Ewan, put a vision out in the past year about what social care should look like. So we've probably got quite a strong degree of consensus. And those visions are built on the kind of co-production that Valentina and Anthony were describing. I mean, the test will be, what are the outcomes for people? In the past year, those lessons of flexibility, of protection, of equality, of trying to really listen to people and interact with them in a new way, of trying to protect those people at risk. You know, those are the key lessons for me, it seems, to take forward and preserve. So that's a national perspective from me. Sorry if I've overrun a little bit there, Ewan. And back to you.
Not a problem. No, you haven't. It's my chairing that's completely haphazard at the moment. So any questions for James, or any thoughts that you want to share on what James has just been talking about? Anyone want to come in?
Everyone is shy. Valentina's got a physical hand
Valentina,
up.
great. Do you want to go first?
I'm really glad you mentioned austerity. You know, those. Yeah, I'm just. I was thinking about it, but I thought I can't put everything in. But I absolutely agree. And obviously, coming from a social work background, it's I really concur with that. Understanding inequality, how health outcomes. It makes me think of David Marmot. He published some really groundbreaking research about the social determinants of health, and I think you're right. I think what's happened in this pandemic, coupled with a 10+ year, well, about 10 years of austerity, has really brought that to the fore.
It's just bursting at the seams. The cracks are just appearing. It's showing it, basically.
Yeah, it's just heartbreaking.
It's scandalous.
It is.
Yeah.
It's utterly scandalous. And I think it was good that you mentioned. I think you mentioned you ran about certain groups, and I know the homeless, the housing issues that we're talking about are so critical on so many levels to so many people. You know, if your housing isn't right, nothing else in your life is. It impacts on everything else. And when I was on EDT out of hours, and one of our priority groups, rightly so, was people who left the armed forces, people, ex-armed forces, people who'd come out of prison, and prisoners just don't get a look in. They're just society would tend to have very negative views about people who've left prison, and it was good. It was good to be able to. These are one of our priority groups, and we will provide them with accommodation. And it was just good to be able to do that. And the ex-forces people as well, and people with addictions, all kinds of things. I just felt, in our small way, we're able to make a difference.
Thanks, Valentina. Does anyone else want to come in with a question at this point? Caroline, go for it.
Hi, yeah, it's not really a question. I just sort of wanted to raise my reflection, really, because when James was talking, it was really making me think about how we make decisions in our lives, and if we're someone who would need support, how we're really governed by the person, that professional's availability, their time, and I just can't imagine how difficult it must be for people when they don't have, where they need that support, but it ends up being fitted into someone's time slot for a discussion. And I just think it's really important to reflect on how we make decisions, and how unfair it is that other people who need support have have to often make quick decisions as opposed to having that time to really reflect on what's important. And that sort of links to me with that idea of prevention and early intervention, because when we're in a crisis, we're having to make really fast decisions about our future, which might not work out very well in the long run. And how, if we had that time to support people and have those conversations earlier, just how that could make a huge difference to choices. So yeah, I just wanted to just acknowledge that, really, that importance of having time and time to talk, really, rather than that rushed sense that we can have to make these huge decisions in our lives.
Thank you, Caroline. Do you want to come back on any of those points, James?
Only to say that it's really heartening that we in the room all believe that the issue of housing and as it were, how to live a good life and to support a wide range of adults is the key issue. I think that we've got more to do on the politics of convincing the government that that's the core issue, because at the moment the politics is all around having to sell your home, homes for older people, and the fact that they're all empty and there's been many deaths. And of course that's right, there have been 31% of all the deaths have been in care homes. So government are really thinking about older people and that agenda. A lot of social services is about working with people for 30, 40 years, creating a good life through those things, housing and so on, and changing the lives of prisoners. That's the thing that Valentina is hooked onto. If you change someone's life from prison, you are changing them forever, potentially for a long period of time. So it's a kind of progression in its purest sense, and getting that point across to government to say that it's worthwhile doing that. It's really hard to pass the Daily Mail test. That's frankly what you're up against. So I just wanted to make that point, that the adults agenda, if I can summarize it as that, has really got a long way to go. We need to push that as professionals ourselves, any opportunity we can, really.
Thank you. Thank you, James. Well, look, thank you very much for your contribution there, James. That was really helpful, really insightful, and really informs our group discussions that we're going to have a bit later. So next up, we're going to zoom from the national down to the local and hear from two of our colleagues. So up first is Natalie Smith from Thurrock, and you're going to talk about the Our Road initiative, which sounds intriguing. So over to you.
Thank you. Hello, everyone. Thanks ever so much for inviting me along this afternoon. I've really enjoyed the discussion so far. It's good to take some time out to reflect on some of these issues, and I hope that you likewise enjoy hearing about what we're doing in Thurrock. So if you could just go to the next slide, please. Thank you. I'm going to talk to you about a local initiative called Our Road, which has grown out of the support that we provided in Thurrock around coronavirus. So I'll just give you a little bit of background though about Stronger Together, which is the partnership that we work in locally between the council and the voluntary sector, and we try and use that to galvanise the widest sense of community activists, faith organisations, voluntary sector groups, etc. Anyone who's got an interest in our priorities, which have really evolved around strengths-based work. So we work very much with CVS on infrastructure support, but Stronger Together is very much about community resilience. If you go to the next slide, please. Thank you. When coronavirus broke, we had a Stronger Together meeting planned for the 23rd of March. And as that date got nearer and nearer, we kept thinking, well, we might have to give a bit more of the agenda over to this coronavirus thing that's emerging. And by the 23rd, it was obvious that the whole meeting would be dedicated to coronavirus and supporting communities. And very quickly, because I think we have such strong relationships in the borough between the voluntary sector and the council, we felt like we knew who had to do what. The issues around voluntary sector engagement, recruiting volunteers, providing that support, making sure we had adequate ways of paying money, etc., fell to the voluntary sector, and the council led on setting up a call centre, looking at those shielding and triage support for more urgent referrals. But between us, within days, we set up a system called Thurrock Community Coronavirus Action, which set to support anyone that was self-isolating or vulnerable and needed support at home. Little did we know that we would be pulled on much more at the Christmas period than we were initially, but that was yet to come. And these are just some of the issues that we were dealing with on a day-to-day basis, very quickly but very effectively, given the strength of the partnership and the ability to pull on professionals and pull on community expertise as needed. So there was a tremendous response. Next slide, please. We, through CVS, recruited over 500 people who were willing to volunteer, helping people self-isolating. And we knew that we wanted, by about June or July, we knew we wanted to capture some of that community spirit, that many of those people maybe hadn't volunteered before, and they would be returning to work when furlough, etc. ended. And what could we do to really cement that community action into something longer term? So we started to develop a very practical toolkit to help people in their neighbourhoods be good neighbours, how they could reach out, giving people very practical tools such as how to set up a WhatsApp group in your street, or hints and tips around how to approach people without being overbearing. A lot of people feel that they need permission to be good neighbours, but helping some of that navigation. And this was all very well received. We had very little capacity to really embed it locally, and we could see the challenge straight away. So we felt like a longer term, more systematic approach was needed. Next slide, please. So we really set about thinking about what we wanted to achieve through our road, and fundamentally we wanted to make sure we had a good engagement programme around COVID-19. Many issues have emerged over the last year around vaccine take-up, staying safe, understanding the rules, vaccine hesitancy, so many different things where that community engagement is absolutely essential to making sure that communities are adequately supported, especially communities that feel as if they are vulnerable in any way or not at the heart of generic engagement and social media. So we knew we needed some outreach around those issues. We also wanted to make sure that the capacity to help within neighbourhoods, to help people within their homes with very small, practical but important tasks were needed to continue. And we wanted to make sure that when that was happening, that people had a chance to talk about their lives, about what was important to them, about how they felt about their local area and what their sort of local priorities were. So that sort of face-to-face and street-level dialogue was emerging as something very important. We also wanted to help remove the barriers to people participating locally. And that didn't really matter whether it was around taking local action, getting involved in the wider community, or re-engaging with activities that maybe somebody did before COVID and have missed the social contact and the physical input of exercise or going for a walk, whatever it might be. We recognised that a lot of people have lost confidence and felt quite anxious about re-entering society. So these are some of the key principles that we reflected on as we developed our road. Next slide, please. So our road developed as the legacy for TCCA. We think we will stop TCCA in its current form with a call centre, etc. We're still taking referrals as people self-isolate when we leave stage 4. But going forward, we've recruited 3 community builders to work in Thurrock, carrying out some of that community engagement and that street level dialogue, supporting volunteers who came forward initially to support through the pandemic, but also trying to recruit new community activists that want to be a good neighbour and support those around them, but need some support and maybe connection to others to feel confident and to do that with ease. So we're developing the toolkit, we're taking in more ideas, that's being tweaked and added to as we gain more experience. And we're looking at an app to try and connect people better. We already have Time Bank very active in Thurrock, so how we bring some of these initiatives together will be quite important to us. We're promoting our road and encouraging more people to sign up, so recruiting more volunteers. And we want to extend that practical support into more longer term friendships, mentoring, helping people to just explore what's important to them so they can lead a better and a good life where they live. Next slide, please. In doing so, we're building a new Thurrock community directory. We've had an asset map for some time, but we're really trying to have a push on this now, using our libraries, using all of our connections to try and encourage every group that's active locally to get registered. And they are then responsible for keeping their own information up to date. So it's good not only for groups to promote what they do and how they can encourage new members, but also for people looking for support to find something easily and accessible in their neighbourhood. Next slide, please. As part of this work, we've developed a Thurrock food network. So much of our time and attention last year was spent looking at food, how we make sure that we provide food with dignity. How do we make sure that we don't end up with gluts of food in one part of the borough and not in others? What new initiatives could we support through the work that we were doing that also help people upskill, learn more about healthy food? So we now have a coordinator who's looking to map and bring together the existing food projects in Thurrock, but also to use that energy to look at new initiatives, be they growing, community kitchens, etc. So we feel quite excited about the opportunity that has come out of COVID around food, and the sensitivity that and awareness really that's been raised through that piece of work. Next slide, please. So ultimately, our road is about encouraging participation, whether it is staying safe, whether it's around dialogue. We are very keen to make sure that people are having their voice through this programme, and with time we are very hopeful that we will have a better angle on some of the priorities which come through traditional consultation routes, and that we can triangulate some of those outcomes and have a better narrative for areas, and that will help commissioning as we go forward. So we've been quite ambitious on where we want to be, but we're starting with very small street level steps. Next slide, please. We've already had some really good outcomes, even though the team hasn't been in post for very long. We've identified some opportunities for increasing vaccine uptake. We've certainly recruited new volunteers and helped to connect different groups that maybe can just benefit from working together more. But for the future, we're really hopeful that this work will help to build local resilience. It will explore some of the opportunities that are emerging from COVID and help to have real dialogue about what's needed to help resolve those in the future, not just through services, but by developing more community-led responses and solutions that are more sustainable and actually help people have better outcomes for the future. So it's a very quick walk through where we've been in Thurrock. Happy to take questions at the right time, but you might want to hear from Simon first. Thank you.
Thank you for that. Maybe one quick question we've got on the thread here. How does this link to social prescribing? Any links there that are important to this initiative?
Certainly. So throughout TCCA, social prescribers were picking up some of the more nuanced referrals that we were having, and they've certainly played a role in helping people with longer term support. And it's really about, I think, building those connections and those opportunities for when social prescribers are supporting people. So what we've learned over the last year has been phenomenal, really. We already knew a lot about what was happening in Thurrock and the extent of community support. And with the new volunteers coming through TCCA, we've got that opportunity to develop more bespoke support locally. So one of the outcomes that we've seen is that we had a cohort of people who really didn't want to return to shopping on their own, were really becoming quite dependent on weekly volunteer-led shops, etc. But through the work that we've done, including some of the support by social prescribers, we've managed to get all of those set up with some sort of alternative support that's helping them to shop independently in the future. So we feel like it's a really strong outcome. Some of those people who received maybe food boxes every week throughout COVID, and once the food boxes stopped, how we move them into a new way of getting support, as they would have done prior to COVID, has taken a lot of work. But those connections that we've learned across the borough have been invaluable.
Thank you. Thank you, Natalie. I mean, this is an example of building on some of the better things that have happened during COVID. Thank you. So I'm going to hand over now to Simon, who's going to take us through an initiative this time in Essex.
Thanks, Ewan, and just to say thanks to colleagues previously spoken. It's certainly grounded, I think, some of the conversation, and it's going to introduce Robert Tetheridge, who's one of the emergency planning officers within Essex, who's going to do we're going to do a sort of double act. Just a bit of context first, if I may, and then a bit about the development, and then what the outcome was from the sort of the COVID social care escalation framework. And there are two elements to this in terms of the size and the shape. The Essex Resilience Forum was obviously started at wave one and sort of built up its strength over the wave one sort of phase. And out of that was born a tactical coordination group for community flow, health and social care, which was chaired by Nick Presmick, who's the DASS in Essex, but had 3 ICSs and also 3 local authorities, along with sort of representation from the acutes, 5 acutes and 12 districts, and 3 community providers. The gravity and the scale of this in terms of Essex is quite significant, and yeah, there are 400 residential care homes for older persons, particularly 400 supported living schemes with quite a large number of people with a learning disability, autism and other needs, mental health needs. So the size and shape of this was sort of wave one. There was a drive to enable people to get out of hospital quickly, and that did happen, but the consequence and the sort of difficulty that it did cause a lot of, as James has mentioned, about the sort of people who live in residential homes, it sort of created a lot of transmission and sort of sadly a lot of deaths within our residential homes with the outbreaks. So we were learning as we were going on in wave one, and I think one of the things that we sort of built up, if we can go to the next slide, please. The context of this in wave two was that you know, we were seeing in the sort of the variant coming through around the sort of October, November, and it was gradually building up, and we ended up sort of obviously you know, sort of seeing the hospitals getting fuller with people who were very unwell. Our staff in both health and social care also sort of had significant you know, infections and isolations, which meant that the pressure, not just in health acute services, but across the social care market was particularly significant. And that's in residential and the domiciliary care market and the supported living market. So our approach to this was that sort of on the 28th of December, there was a major incident called by the health colleagues within the Essex Resilience Forum. And what then sort of came about was that on the 8th of January, that Nick Presmick and the sort of the 3 DASSes, you know, we felt that there needed to be a sort of collaborative and a different response to this, because we could see that there needed to be good support for the providers and also the sort of the provider sector. So we put together sort of a 5-point plan, but out of that there came sort of 5 priority areas and actions, and one of them was around making sure we had a proper response going forward. And the sort of the development of that response was around looking at the significant pressures within the hospitals. They were sort of had oxygen shortages, they had staffing shortages, and also bed shortages. So we put together this plan in a collaborative way. So I chaired a number of joint multi-agency groups working with health colleagues across the 3 ICSs within Greater Essex and the 3 local authorities. And this was on a daily and day-by-day basis, building up this plan over a period of 1 to 2 weeks, with the support of the emergency planning officers from Thurrock and from Southend local authorities as well, because we couldn't have done this in isolation. If we could just move on to the next slide. What I'm going to ask is that then probably Rob actually picks up the sort of how this was developed and formed and I'll summarise at the end if that's okay and take questions. Rob.
Yeah, no problem. Hi everybody. So what seemed to be missing was what the health partners had their language for how they could talk about pressures in the OPAL system, but we didn't have a shared language that we could talk about the pressure that we were faced in the social care system. And so this framework was developed that allowed us to agree that common language about the pressure levels that we had, and it was shared across all health and social care partners. Against that framework, which we called the lapel levels, the social care pressure escalation levels, are a set of agreed actions and mutual aid principles, so we can understand that in advance. And we also, through this work, explored some of those worst case scenarios where particularly care homes were coming under the sort of pressure that they were no longer able to provide safe care. And what we learned through the conversations was that there were quite different approaches that people would take in those situations. And through the framework, we were able to understand those different approaches, and partners were able to understand how they could then support those different approaches. So to get to that point, there was some quite detailed level planning that took place by each of the three upper tier local authorities. A big project team, Essex County Council, some of which are on this call as well, supported the undertaking of workshops across CCG footprints, where some detailed level planning with colleagues at a range of different levels, including operational teams, was undertaken. And that allowed us within each of the upper tier authorities to start producing our own really detailed plans set against those different lapel levels. And then we brought together summaries of those into this multi-agency Essex Resilience Forum framework, which is on the screen, which we then ultimately stress tested in an exercise with multi-agency partners. So yeah, I think that's probably all I'll cover there, Simon, if you're happy.
Yeah, thanks, Rob. If we could move on to the next slide, just to summarise, if I may. I mean, part of the in equivalent in health, is something called OPAL, which is Operational Pressures Escalation Level, and we sort of phrased it, and this was driven a bit from Benedictine Southend Council, who framed it as the local authority escalation levels. What you see on your screen now, we can sort of share the whole document because it goes into a bit more detail, is an approach when we escalate at each of those different levels when we see market capacity under extreme pressure. So, for example, we had at one point about 196 residential homes, all at very sort of very critical levels of staffing and also outbreaks. And that was predominantly around the staffing side because of a lot of the residents were sort of fairly safe and secure, but we still had outbreaks going on, and the testing regime had sort of significantly improved. The other sort of element that sort of had to come into play here was the designated settings, which is a specific residential home that would actually take people with COVID positive, so they could isolate coming out of hospital. That was a challenge, I think, not just for Essex, but a large number of local authorities across the country to make sure people had the right place and the right care at the right time. And we sort of looked at the mutual aid elements around the provider of the last resort. So when we knew a care home and there were about 3 or 4 failing because of their sort of staffing levels, we put together a mechanism where carers and support was going into those residential homes through our care hubs, and they were locally managed across the care sector because of the size of Essex. So we regionalised that. So if we needed mutual aid from one part to another, by agreement with local authority and our health partners, we would manoeuvre and trigger staff support. So when we get to the point of level 4, which we did on a couple of occasions, we would relocate staff from one area to another to make sure that we didn't have to go into a major incident of moving people from their care setting, which would have been very, very difficult and detrimental to those individuals. And it was about that coordination, communication. So we would actually look at the whole of Greater Essex, but then look at individual parts so that we can actually make sure that everything was covered, and regularly communicating the risks on that. And I think the sort of the key successes of this was good communication, good understanding, and yes, there were some difficult conversations with colleagues in the health service, partly to do because I think that they were under significant pressure with their staff, and it was about how we supported them at that particular time. And we actually had to test some of this in another real situation where we had a major incident in the Harlow area where the waterworks pumps failed for 150,000 people across the sort of the Harlow region or that area. You know, on that particular day I was Gold Command, so I ended up sort of having to sort of work with many colleagues on this call, but also in other areas to make sure that we had a robust response. So we used some of the mechanism of this structure to do that, certainly from a social care and a health care perspective, because we had a lot of vulnerable people who were going to sort of be without potentially water, but also working with our police, fire brigade and other partners to get to that point. And we also then designed, in terms of Essex, particularly through some of the colleagues on this call, something called a lifeboat crew. We trained up about roughly 50 of our staff to care standard support needs, so they could actually go into people's either homes but also within the residential care sector to make sure that people got care overnight if people didn't turn up for work, which was happening in some areas. So again, another type of response, and you know, the flexibility of our staff and also our partners was I think you know, sort of really refreshing. I think I'll stop there, if I may, Ewan, just to answer any questions. But finally, just to say, it was a collaborative working approach, and the LRF or the ERF have signed this off as a working document, and we're working. I mean, we sort of share this around the region for other colleagues to maybe use or modify as they so wish.
Thank you, Robert and Simon. Just one quick question from me. This was obviously born out of an emergency, out of a crisis. What elements would you keep if we could imagine we didn't have a pandemic at all? Because it sounds like this has let you or enabled you to work in quite different ways. Any sense of what you would keep and maintain?
Yeah, well, I think we've agreed you know, with the ERF that this will be a document and an agreed way for any major incident that social care and health colleagues actually experience, because quite often or not, a lot of the major incidents do involve you know, the most vulnerable in our communities. So in terms of keeping, we would keep the framework, we would keep the communication and the sort of the good joint working relationships. And what's been born out of this as well is that the community operational group that I sort of chair every month now, because we've stepped it down, we are going to start to use that as a mechanism, planning for the future for not just any potential other waves, but also for the winter periods where there's significant pressure. So it will be, nothing's lost. We've actually used it as a very sort of helpful way forward.
Thank you. Maybe time for one more question before we have a bit of a break. Anyone have a question for Robert or Simon? If not, thank you very much. Thank you very much to all three of you, actually, for some very interesting and thought-provoking presentations. What we're planning to do now is have a bit of a break, but because we're a little bit ahead of our schedule, I'm going to be mean and shorten that break a little bit. So I'm wondering if we could all come back in 10 minutes at 3:30, and then we'll break into some group work. So 3:30. Be ideal if you could stay online, actually, and just mute and turn off your camera, and then we can put you into groups as soon as you come back. Okay, then. See you in 10 minutes.
I could try it.
No, don't bother. It's fine. Oh, okay. So welcome back, everyone.
I can put the questions in the chat, though, if that's helpful.
Yes, please.
Yeah, that would be really helpful. So what we're going to do now is break into 4 groups. We were going to have 5 groups, but the numbers have fallen away a little bit, which is hardly surprising. It's Friday afternoon, and we're going to have a facilitator in each group. And what I'd really like us to do in each of these groups is to adopt a bit of an appreciative inquiry type methodology. So in thinking about the topic that we're discussing in your group and thinking about the year we've had, what are the positive things that we can take from that and how do we build on those? So the questions I've got for each facilitator are: what worked well during the last year? What do we need to build on? And how do we make it happen? So those are the 3 questions that I'd really like us to work to in the group discussions. And we've just got, I'm just checking what the situation is now. So we're going to have one group on co-production and building community resilience, one on care markets, one on partnership working, one on workforce. Unfortunately, due to the relatively newness of putting people in groups on teams, we're actually going to put you in randomly. I really hope that's okay, but it just wasn't possible in the time that we had to allocate people to a preferred group. So hopefully, whichever group you join, you find the discussion interesting and informative. So I think it's over to you, Fiona, to allocate us to groups, and we'll hope it works.
Bear with me.
Cheers.
Oh, how do I? Yeah.
Hello.
So
I
varying
don't know
degrees
how many
of
people are
success.
back yet, but some. Is everyone back?
I can't see anyone in any rooms.
Okay, so hello. All right, I'll wait a bit. Hi, Anthony.
Hello.
Which room were you in? What were you talking about?
Workforce and employment, I think. Yeah.
Workforce. Is everyone back, Fiona, or are we waiting for anyone else?
I think that should be everyone. I don't have any rooms left, and quite a few people I saw on the chat had to leave.
That's fine.
Lots
I
of
think quite a few
emergency
people have
phone
had
calls.
to leave, so we are. Yeah.
So yeah, I feel
that's
very.
fine. Well, look. What I would like. No, you haven't lost anyone. It's not your fault, Fiona. I'm joking. Sorry. It's the people have had to leave. Okay, so what I thought we would do for just the last 10 minutes or so, what you're right, was just to identify a few key points from each of the group discussions. And I'll kick off if that's okay. So I was in the group talking about the provider market, and I think key points for this group were firstly a general feeling that relationships between the council or practitioners and providers had improved, and that actually conversations were all more open, more flexible, less formal. So people were using, for example, Facebook to talk to some of their providers, and generally people were getting around the table more often and mucking in to try and find shared solutions, and that there are plans to try and keep those relationships going into the future. And that, you know, did link to a conversation about digital technology and the fact that actually you can get all your providers in the room very easily, and actually it's very beneficial for a lot of people, particularly people with lived experience, to be able to engage online, and that we shouldn't assume people don't want to to use digital technology. And then we talked a lot about new models that are emerging. And there's a strong sense that across the region and across the country, actually, there's going to be a growth in extra care, in home share, in micro enterprises, in shared lives. All those models have a real potential to grow, but only if we don't suffocate them and don't interfere too much and don't put too much bureaucracy around that. And there was a bit of a fear that the NHS, in the way it commissions, might actually not be able to operate at that very small level, at that very community level. So there's a real concern that that doesn't get in the way. So yeah, so there was a lot of positive comments about what's happening, and also that even more traditional care homes are beginning to think about how they adjust to become maybe almost hybrids, where they have some bed capacity and they do some home care, so that they've started to shift how they operate. So there was a lot of interesting conversations, and I think, Natasha, it's right that you're saying there's other wider work in the region on this issue that people should maybe get involved in. Were you saying there was another strand of work here?
Certainly, as part of the Building Positive Futures programme, for example, we've got a session coming up on home share and shared lives, which is in February. We have got quite a few sessions. So we've got sessions on personalised care programme, on social prescribing, on mental health transformation and integration, on co-production and the golden age of pirates, on a methodology called Working Together for Change and developing or co-producing the carer strategy in Central Bedfordshire, assistive technology, support brokerage. So I ask people to have a look at the programme and book on if you can, because it's what we're all about is shaping the market in a positive way and offering more choice and control for people.
Thanks, Tash. Just from my group, Paul, I don't know if you're still there. You were talking about something quite interesting with how you might work with the voluntary sector. Did you want to just share that? I thought it was really interesting.
If I can remember, I've got dementia. Yeah, I mean, I think in terms of looking at working with the voluntary sector, I was looking at rather than having personal assistants, so you've got the one-to-one, which is quite difficult, especially in my world, if you need, be able to British Sign Language or whatever, and other people with, whose English is not their first language. It's quite difficult to get those kind of personal assistants. And I think what we could do with our voluntary sector partners is actually have sort of a contract with them and engage with them a bit more, use their volunteers. So, if a person has got 5 or 6 different interests, one PA might not have those same 5 or 6 interests, but actually a cluster of them will. So it's about building those relationships with, with several people within a voluntary organisation.
Thank you, Paul. Really interesting. So I'm now going to move on to Tina's group, which was looking at co-production and building community resilience. What were the key points in your group?
They were very much sort of recognition that the voluntary sector and community sector kind of got on and did it because they had to, and they did an excellent job, and probably far better than we did. And we reflected on the NHS volunteers and how they weren't particularly useful because they were it was the wrong model. Let's control them from the centre, and also in fact some of our sort of council volunteer models weren't successful. The real experts are the community and voluntary sector. We reflected also on the fact that having someone from your street group knock on your door and introduce themselves and actually ask if there's anything they can do to help and what it might be is actually co-production at its best. You're actually deciding together what to do and you're going and doing it. So we reflected on all that good stuff, and then we reflected on the fact that now we're starting to wind back from the pandemic and that urgency. Several of us as local authorities are now starting to say, well, what's our strategy now on the community and voluntary sector? And we're trying to make something a strategy, which potentially can take away all that that sort of roots up flexibility and co-production by fitting things into a box. And so one of the things that I think it was Maxine that said is, let's not impose bureaucracy where there wasn't bureaucracy. You know, if it worked without bureaucracy before, how can we make it continue to work without bureaucracy? How acknowledging that that we can't just expect things to work with no funding, and there might be ways we need to make some element of money available to try and support these things to continue, but let's not make it a whole tender process or an industry in itself that people can't make. We also reflect on the fact that sort of I think something that was mentioned by Ewan's group as well is the digital resilience bit, and don't make assumptions that people don't want to engage digitally, because actually some of the work that we did during the pandemic revealed that they do want to be able to do it. There are lots of blockers to that. And so I think historically we thought, well, older people prefer a hard copy thing, so we'll make some hard copy things so we don't exclude them digitally. Well, we're kind of still excluding them digitally because we're giving them an alternative. And it was about how we then build sort of an individual personalised approach to digital resilience as part of our care and support planning process, or as part of our preventative work, to really find out what is the thing that's stopping someone being able to engage with the digital world, because the digital world is very important to everyone's lives these days, whether we like it or not. So there was that aspect. I'm going to just check. Tim and Maxine, have I missed anything crucial?
No, I think we were definitely more about the learning from the Levelling Up report from Danny Kruger was the thing that was the golden nugget, and yet that seems to have been lost in translation as we head back into the world of computers and forms and stuff. And that the co-production element, you know, we're inviting people to come and co-produce. But actually, are we recognising the expertise, the skills, and the kind of levels of consultancy almost that they bring to the table? And yet we're expecting people to be, again, available to us when actually the manners of that, the basic manners of that, and the exchange of reciprocal kind of sharing of information and personal stories, you know, we need to think about how we do that and recognise people's contributions. Not just saying financial recognition, because that's not always the answer, but you know, it could be access to things that they've struggled to get access before, unblocking things that might help them facilitate and enable ideas. So it was trying to sort of unpick that, really.
Yeah, sorry, Maxine, you did mention, didn't you? It's not always money. It can sometimes access to a room, isn't it? It's sharing our assets back to the community.
Fantastic, thank you. Right, I'm going to come to Fiona next to talk about workforce and the key points from your group.
Great. Please, my group, please jump in where I was, because while I was also sorting out people coming out of rooms, I was also trying to copy the notes. So, so I think the one thing to say around the workforce, that's what the group that we had was very much an acknowledgement of the dedication and hard work from the workforce and people going above and beyond. You know, to make sure that things were you know, people were supported as best as possible. So I think that was the first point, and I think that would probably be acknowledged around the room. I think there was an acknowledgement that what it created was a real positive. And it's funny that we took out digital, but I think that was the right thing to do, because actually digital goes through all of the subjects. So I think that was that's interesting, because we ended up sort of focusing on the digital aspect. So what worked really well was around sort of being able to still be able to support people through different means, but also the acknowledgement that remote working meant that people weren't able to get that sort of emotional support. You know, they might have really difficult conversations and you're sat in your living room or your own bedroom, depending on, you know, the setup that you have. So making sure that, you know, how do you balance the flexibility of remote working and that COVID, you know, enforced, but without, you know, making sure that people get that right support. So there was definitely that aspect. I think there was something also, Adrian, if you don't mind me saying, it was really nice that he's, you know, shared with his teams. He would drop in and out of teams meetings to talk about how he's balancing sort of his home life with working from home. So you know, that storytelling, but also that real human aspect of we're all working together in the same way. So you know, it's not, you know, leading by example about helping people, say, you know, understanding that it's complex. So you've got caring responsibilities, you're also trying to work from home, and schools weren't working, you know, so it was a very weird time. And I know some schools are closing again, so you know, we need, you know, that might happen again. Some positives around sort of an enforced push for some of the workforce to embrace digital technology, that there might have been a pushback. You know, someone in the group was, you know, sort of trying to get workforce to use laptops remotely before, and this meant that they pretty much had to, so now they're not going to go back. So very, you know, very positive. I think what there needs to build on is that sort of challenges of onboarding. How do you help people in, you know, sort of when we're working more flexibly, to get that induction well and into teams, because it can feel quite isolating, making sure people switch off and take breaks, and make sure it's true flexible working, not people are on all the time. And I think one of the things that we ended on, which I thought was a really rich conversation, and it was great because I had Anthony and Valentina in the room, was actually what this has hopefully opened up in terms of thinking about the workforce and the diversity of the workforce. And we recognise that COVID has really shone a light on the inequalities aspect, and you know, different you know, Black and ethnic minority groups and people with disabilities, and how they were disproportionately and are disproportionately impacted by COVID. But actually, given a workforce issue, what has COVID enabled people to think about? Well, if we're working more flexibly, what does that mean for opportunities for people that might not be able to do a more traditional 9 to 5, might not be able to get into an office all the time, and actually, you know, a check for the people in the room about what might help enable your thinking now going back, about what opportunities that might mean for the workforce and your equality diversity aspect. So that was sort of my initial thoughts, and it was really good that was our sort of ending conversation, and that was a real rich conversation, and thinking about the opportunities and not going back to traditional ways of thinking. The group that I was in, does that sort of cover what we discussed?
Yes,
I
Fiona.
didn't do it justice.
Yes, Fiona, you covered most of it, but towards the end of it, we did ask the group should self-check to see how many disabled people did we employ, be it pre-COVID or no post-COVID. It's not like supporting a disabled person during their employment. It's supporting new disabled people right from beginning of their new journey.
Thank you. Great. Thank you. That's really good. Just a sorry. My screen is beginning to crack up a bit, so I'm struggling to follow it a little bit. So just the final, but not last but not least group was Chris's group. Would you like to give us some key points from your group? That'd be looking at partnerships.
Sorry, Chris was on his own for quite some time because the system kicked him out for a bit, but I hope I did get you back in there eventually.
Yeah, I appreciated what Fiona was just saying about breaks for the workforce, and it's obviously some very smart technology you've got here, because it identified that I needed a break and put me in a quiet space for 10 minutes. So whilst I was sat in my quiet space, the group got on and self-facilitated, which was fantastic, and then gave me a little bit of feedback at the end. So I'll act as a conduit for what they described to me, and if they then want to chip in, then please do. So the thing which was described first of all was about partnership not just being about between adult social care and the NHS, which is I think what we all kind of default to, but also actually about developing partnerships with local communities and the people who actually need support. And I think that chimes with the feedback from the first group, and it's certainly something that I've taken away to talk with Tash about in terms of our prevention and personalisation programme, and how we might actually work not to lose that community capital and goodwill that develops during the early stages of the pandemic. I think the second thing, which we talked a little bit about, or they talked about and then described back to me, was about the way in which some of the inter-organizational barriers were just let go of. And so some things which perhaps we could have done years ago and perhaps should have done years ago were accelerated during the pandemic response. We talked a bit about discharge to assess and virtual wards. Also, though, about aspects of NHS provision into the care markets and oversight of people's health in that sector. I think the final thing to feed back, which again I would really want us within the ADASS regional programme to take forwards, is something around how personalisation could be brought not just to longer term care but shorter packages of care as well. You know, what are the opportunities to look flexibly at how people who are coming out of hospital or need to come out of hospital, how they can be supported, so that we don't just funnel people through one process, if actually there are easy things that could be done to actually help their journey. So I'm going to stop there, but I think I really ought to give an opportunity to Hazel, Luke and Caroline just to offer anything that they want to in addition to that, given that they were the ones who had the conversation.
It's as if you were in that room, I tell you. Yeah, any comments, further comments from that group?
No, I think that was a good summary. Thank you, Chris.
Thank you.
Brilliant. Okay, well, look, we're actually just about at our time. I was supposed to bring this together seamlessly into a set of themes, but actually I think once we write this up, I think that those themes will become clear. So I will endeavour in the report, the brief report we're going to write, just to set out some key priorities that I think have emerged from this discussion, because it has been a really rich discussion. I just want to close by thanking all the speakers, particularly Anthony and Valentina, but also all the other contributors for really making this a very interesting and thought-provoking discussion. And apparently there's a football match on, which being a Scotsman, I'm not interested in at all. But I enjoy the rest of the evening and enjoy the weekend, and we'll be in touch very soon. Any final comments? Have I missed anything? Okay then. Thanks a lot, everyone. See you later.
Thank you.
Thanks, everyone.
Thank you, Anthony and Valentina.
Bye.
Thanks, Ewan. Thanks,
Thanks,
Steve.
everyone.
Nice weekend.
Bye.